Hi, everyone. Welcome to the Maternal Health and Wellness event here for Junior League of San Diego. I appreciate you being here this evening. My name is Beth Giddens, and I'm the Focus Area Ad Hoc Chair. And first, we're going to talk about the agenda for the evening. So we have quite a full agenda. First, we're going to talk about what the Focus Area Ad Hoc Committee is. Then we're going to dive into a little bit of what maternal health and wellness all includes. Next, we're going to introduce community connection and evaluation. I'm very thankful for this committee, which has helped put me in contact with a lot of the community partners. We're going to have 3 community partners present with us today. Then we're going to dive into internal junior league committees and how they support this potential new focus area for us. And at the end, we will discuss the Maternal Health and Wellness Challenge Week that we did a couple weeks ago. Slide. So the charge of the committee for the Focus Area Ad Hoc Committee is to determine the new focus area to replace TAY and human trafficking. Why, you may ask? Leagues do this periodically. So they're supposed to fill a gap in a service area, implement services, and then eventually hand off junior leagues work to a community partner to continue implementing. So it's now our time to do that. We've had TAY and human trafficking for quite some time, and so we're moving to a new focus area. The ad hoc committee has been active since 2019. So I'm sure you have contributed to its efforts. The committee has sent out multiple surveys to membership over the past couple of years, asking about ideas for focus areas. We started with 14 and membership helped us narrow down to 3 to 5. At that point, once we had a smaller group, we researched the needs in San Diego, as well as contacted community partners about their needs and gaps in services. We've also provided training at GMMs, and we've led discussions at neighborhood GMMs, even one most recently just earlier this month at the October neighborhood GMM. We've also had impact opportunities and informational sessions about the focus area. And in December of 2020, the Junior League of San Diego Board of Directors voted to proceed with 2, food insecurity and maternal health and wellness. And so that has brought us to our work this year. Slide. So we are in November going to present to you the 2 new focus areas, food insecurity and maternal health and wellness. And we're going to essentially summarize all the work that the Focus Area Ad Hoc Committee has been doing. We're also going to have some community partners as well to be able to take place with a panel. And so you'll be asked to, after you have all of the information that you need, you'll be asked to vote in January for a new focus area. So before January, please watch out for some impact shifts in both areas. You of course had the discussion last month. You had the food insecurity event with a pre-challenge in September. And then so here is our maternal health and wellness event today, as well as we had a pre-challenge as well. So that's been our work this year. So let's go ahead and dive on into what is maternal health and wellness. So this is a graphic from the CDC Division of Reproductive Health. Maternal health and wellness is a really broad topic. So here you can see all the different ways that it's subtopics within maternal health and wellness. There's also even other branches that could potentially get added to this, breastfeeding policy, unplanned pregnancy, and more. So maternal health and wellness is super broad. So today we are going to have a few community partners talk to us about just a few of these areas, that being mental health and breastfeeding. But just in general, the definition of maternal health and wellness is that it's the overall health and wellness of women during pregnancy, childbirth, in the postpartum period up to 6 months. Slide. So these are some maternal health and wellness stats. So according to Healthy People, improving the well-being of mothers, infants, and children is an important public health goal for the United States. Their well-being determines the health of the next generation and can predict the future public health challenges for families, communities, and healthcare system. 700 women die each year in the US from pregnancy and its complications. Black women are 3 times more likely to die from a pregnancy-related cause than white women. And then some San Diego specific statistics. African-American infants are 1.3 times more likely to be born premature. over 1.5 times more likely to be born with low birth weight, and more than 1.5 times more likely to die during their first year of life. I've been working with community to identify community partners, and we have lots of different community partners. These are just some of them highlighted here in this box. Maternal, Child, and Family Health Services, YMCA of San Diego County, WIC, Women Give San Diego, San Ysidro Health Center, Maternal and Child Health Center, and we have many, many more that have been identified. Slide. So I would now like to ask Michiko from the Community Connection and Evaluation to talk about her committee's work.
Hi, everyone. Thank you for having us. The mission of CCE is to evaluate and improve existing partner relationships and identify partners for our new focus area, as Beth was saying. If you want to go to the next slide for me. So our goals are to facilitate interaction with the community partners in JLSD, continue to improve the processes for how we're managing our relationships with these partners, and making sure that we're meeting all of their needs. Also evaluating and improving the partner and league satisfaction, while also actively identifying and engaging with new potential partners that are out there. Next slide. So the CCE consists of 14 members. Each member is responsible for being the main point of contact and owning the relationship with their assigned group of partners.
Thank you so much, Michiko. So we would like to go ahead and introduce our first community partner speaker, Jen Fisher, and she is the president of Postpartum Health Alliance. Prior to entering the mental health field, Jen started her career gaining a background in education and nonprofit management. As a program manager, she spent years developing curriculum, leading trainings, and stewarding corporate volunteers and donations. In 2010, Jen obtained a master's degree in marital and family therapy from the University of San Diego. She completed most of her clinical training at UCSD Reproductive Mental Health Clinic, working alongside physicians, midwives, and psychiatrists to provide a unique collaboration on the screening and treatment of perinatal mood disorders affecting women and their partners during pregnancy and the postpartum period. Jen is currently in private practice in Point Loma and enjoys supporting couples as they transition into parenthood. She has specialized knowledge in the areas of maternal mental health, attachment and bonding, birth and trauma loss, infertility struggles, and adjusting to parenthood while preserving your marriage. In her free time, you can find Jen spending time at the beach or in the desert with her husband and 3 children. Jen, thanks so much for speaking with us today.
Hi, thank you. Can you guys see me okay? I'm actually
Yes.
currently hiding from my 3 children, so I realize I'm like, oh gosh, is this room I'm in even bright enough? Okay. Let me share. I know you guys are gonna let me share my PowerPoint myself. So let me just pull it up real quick. Here we go. So I'm here on behalf of Postpartum Health Alliance. I'm their president. I've sat on the board now and volunteered with the organization, gosh, probably for about a little over 6-7 years now. And what I thought might be helpful is I threw up a couple of slides just to give you all an understanding a little bit of what perinatal mental health looks like, as opposed to just maybe your sort of general mental health issues that you see throughout a lifetime. And then at the end, I'll kind of explain what Postpartum Health Alliance does on a local San Diego level. So when it comes to perinatal mental health, what we often see after birth is it's a little bit of outdated lingo, but it's called baby blues, and or some people will refer to it as, oh, I felt the postpartum, but the postpartum is actually just a time period after you deliver a baby. And according to medical, the way we diagnose, it's usually up to that first 2 years after birth is considered the postpartum period. But for a lot of women, a lot of mothers, and about, I'd probably say about 80 to 85% will experience what's called the baby blues. And this happens within the first couple of weeks after birth. Hormones are adjusting, emotions sort of can feel up and down. There might be some tearfulness, some feelings of overwhelm, a little bit of on edge. You're adjusting to a baby's new sleep schedule and feeding schedule, which might be once every hour, once every 3 hours. And so that's a lot on our bodies and our minds. And so for a lot of new mothers, the baby blues, it can feel like sort of an up and down period of emotions in the first couple of weeks. But that tends to sort of even out after a while. And sorry, are you guys seeing the presentation okay? I think so. And then
we are now. Is this a good slide to be on?
Yes, no, this is perfect.
Okay, perfect.
Okay. So the baby blues, like I mentioned, is it's just a common time period. It's more of I like to think of as more of an adjustment period of your body recovering physically and mentally from having a 9-10 month pregnancy and then a birth. And then adjusting to taking care of a human being whose needs and demands you're trying to figure out every moment of the day. And so it can be a bit of a learning curve, and there's a lot of emotion that comes with that. So that's pretty common. Where we see though mothers and parents start to struggle is typically a few weeks later, and sometimes this can happen months later or maybe even a year or so later. And they can start to struggle a little bit more with their functioning. And that's when we start to see this sort of other side where it's not baby blues, it's more of a perinatal mood and anxiety disorder. And when I say perinatal, that summarizes the time period of the beginning of the pregnancy all the way to approximately 2 years postpartum. So it's kind of like a 3-year cycle or lifetime, if you will, of assessing a mom's mental health. And when it starts to impact functioning, meaning severe is deeply impacted, care for baby is deeply impacted, mom's emotional needs and physical needs are not where they quite should be, that's where we start to fall into what you're seeing here, perinatal mood and anxiety disorders. And just to make it easy, we call them PMADs in the mental health industry, because it's kind of a mouthful. But you'll see listed under here, there's perinatal depression, perinatal anxiety and OCD, perinatal PTSD, bipolar disorder, and then very, very rare, but is considered a medical emergency, is postpartum psychosis. So these are where, like I said, mom's functioning is being severely impacted, and she's not taking care of herself or her baby in the way that she needs when it comes to basic needs, whether it's attuning to the emotions, whether it's dressing oneself, feeding oneself, getting out of the house, going down the street to the park, things like that is starting to really inhibit the way that mom is functioning. Okay, let me see. I'm going to move on to my next slide. I don't know if I can do it because I feel like, thank you. I will just say slide and you can move it for me. Okay, perfect. So with research that's been done on perinatal mental health, it's anywhere from about 20 to 25% of all women experience a PMAD, a perinatal mood and anxiety disorder, but we suspect that is underrated. We suspect it's undiagnosed a lot, but it's also unreported. And then there is some new information that's been coming out since COVID has begun that this number could actually be almost double with the way that the pandemic has affected women and their experience in being pregnant and their prenatal care or lack thereof, in the concerns around their health and their baby's health as it relates to COVID. And then obviously the way that the pandemic has ultimately shifted everything that we know upside down when it comes to our jobs, to childcare. So that has significantly impacted mom's mental health, especially in the last year and a half. You can go to the next slide, please. So perinatal mood and anxiety disorders, this is actually a public health crisis because it has a long-term effect. This isn't just a, oh, mom had a couple hard years or a few months, or, you know, maybe baby had a hard adjustment, but hopefully, fingers crossed, things will work out okay. Sometimes that does, but there is actually some research that has come out that there is some significant impact on our society overall. And when you look at, let's see, there we go. You look at the parent when they are struggling with a mental health condition during pregnancy or the postpartum period, their life satisfaction, their daily functioning, their self-care, and their parenting is being affected. Then you move on to the child. That can affect their physical health, their mental health, as well as just their life trajectory as well. And then if we move up another level, it impacts our family, the family relationships, whether that's between, you know, partners and within that marriage, or maybe it's extended family, whether it's in-laws or it's the family of origin. There can be a lot of stress that happens within that when there's a family member that's struggling with a mental health issue during this time. And then on a macro scale is our society starts to feel the effects of this mom struggling when there's loss of productivity, whether that's at her job or maybe she's fully pulled out of the workforce to be able to attend to her needs or her child's needs. There's healthcare expenditures, and then the big money, the ticket price on this is costing the US about $14 billion, or about $31,000 per mom-child pair. The fact that we're not addressing her mental health and the impact it's having on her as well as her child. So this is costing on a societal level a lot of money for our country. So if you want to go to the next slide. So what does that look like in regards to just parenting? What's the impact? So I wanted to break that down just a little bit more to show you how a mom that's struggling with depression or anxiety, or is not sleeping well at night because she's got these really intrusive ruminating thoughts of, gosh, will the baby stop breathing? I need to keep constantly checking on them. Or what if I fall down the stairs and I drop my baby? Or, you know, how do I know that I'm cut out to be a good parent for this child and their health? And so when we see moms struggling like in this way, how this affects their parenting is we've seen that 27% will see a decrease in breastfeeding, or the length of breastfeeding for that child. Approximately 26% will see a decrease in the amount of talking and engagement with that baby. 39% will see a decrease in just routines established, you know, getting up out of the house, going to the grocery store, taking their kid to the park, just attuning to, you know, mom getting the chance to have a nap once a day, or getting a chance to hop in the shower. Those needs start to get pushed to the side. 30% will see a decrease in the amount of play with baby, and play is critical. I mean, this is how they learn the world. They put everything in their mouth. They're watching their parent. They're watching their parent's facial expressions of knowing what's safe, what's okay. Is, you know, does my parent care about me? You know, am I getting those hugs and those kisses and that attunement that helps build the foundation of that parent-child attachment? And then 19% will see a decrease in the amount of reading to the baby as well, which we know that that's a huge part of how babies develop their language in the very beginning. So on the next slide here, we have broken down the impact of now when you see that on a parental level. Now on the flip side, this is how we're seeing it impact in a little more detail for children, for babies and children. So while mom's pregnant, an embryo, that baby has a higher chance of having higher intrauterine growth restriction. Mom has a higher chance of having a host of other medical conditions such as preeclampsia, which is high blood pressure, gestational diabetes, and then mom's stress is exposing baby to her stress hormones. So this is affecting the development of baby while they're in mother's womb. Then when you go to the newborn stage, we often find that labor will happen earlier, there will be lower birth weight, there's a higher chance of them being in the NICU, and there's also just a higher likelihood that mom is not able to attune to baby, like I mentioned in the prior slide. And so that can set the foundation for insecure attachment with her child. And if we know anything about relationships, it's that a lot of our relationships that we have as teens and as adults in the later years, that foundation for the kind of healthy relationships that we have later, those are usually, the foundation of that is set between mom and baby. Or it can be another caregiver that's a consistent caregiver, whether that's dad or grandma or aunt, but that person that's there for a majority of the time attuned to that child is setting that foundation. And then as the child gets older, the more likely that, if mom is struggling with the perinatal mood disorder, that child is more likely to have a host of not only medical health conditions such as obesity, or they might have a lot of other mental and emotional health issues as well, such as self-harm, more likely to substance use, poor social skills, and learning and mood disorders. And then as that child reaches adulthood, then what we're seeing, oops, let's go back real quick. The last section, there we go. Adults that were, when their parents had struggled with a perinatal mood disorder, these adults now have continued a list of medical conditions, mental health conditions, struggle with relationships with adults, and additionally substance use and addiction. On the next slide. So overall, with perinatal mood and anxiety disorders, most of these, so they happen during the pregnancy, like I had mentioned, and typically up to 2 years postpartum, and they can happen anytime. It's not always just that first couple of days or weeks after delivery. A lot of times, if you have a history of mental health struggles, that sometimes that's important to take note during the pregnancy. A lot of moms aren't always happy and glowing, which is what's expected of them. Oh, this is the best time. You're about to, to have a baby, and this is the way that we treat moms in our society is we sort of put this on the pedestal that this is the most important role they could possibly have, and it carries so much weight. And then the second that they meet their baby, if they have the perfect in the nursery and all the perfect things in their registry, that everything will line up and will be fine. But for a lot of moms, that's not really what translates during the pregnancy. And so some of that mental health things start to bubble up, but it's often missed because a lot of care providers during this time are not necessarily screening for mom's mental health. They're just kind of checking the basic medical need. So then what's happening is sometimes by the time that mom has had a birth, and especially if it's a really rough birth or not what was planned or desired, that can sort of catapult into mom really struggling to that adjustment. So we see this sometimes in the very early in the pregnancy, sometimes right after birth, or like I said, sometimes it happens a year or two later where the mom's just feeling like, I've been in this fog, I haven't felt good. I guess I just kind of assume my OB said, well, this is what motherhood is. You're supposed to be tired, but that doesn't translate to what's actually happening with mom. So if you want to click again, a couple other facts will pop up. So what's really interesting about this though, is that when it comes to our prenatal care in the US, we screen for so many things during the pregnancy. Oh my God, like some, especially God forbid, if you're above the age of 35, which I've had two of my 3 children above the age of 35, I'm considered a geriatric pregnancy. So that means that I would need, I have the option of doing a lot more invasive tests and screening, which is helpful in some ways, but can also create a lot of anxiety and stress for that parent as well. But what's so interesting is we're screening for all these genetic things, biological things, blood pressure, diabetes, but oftentimes we are not screening for mental health, which ends up actually being the most common complication following childbirth. So like I mentioned earlier, it's under-recognized, it's undiagnosed, it's often untreated, but it is very, very highly treatable, and it's stigmatized. So that's what has kept it, I feel like, stuck for several generations at this point. I want to click the slide one more time. So about 60% of women or birthing individuals will experience a PMAD, and it will go undetected and undiagnosed, and 75% of those will never even receive treatment. So even though PMADs are common, they're not normal, and they often do need support from professionals and providers in the birth field. So real quick, what I love for all you to do is, this is just a snapshot. If you want to click it a couple of times so the words can fill in underneath each of these sections. These are risk factors for parents when we're assessing as a provider the likelihood of a mom or a parent that has the potential of experience a perinatal mood and anxiety disorder. And if you look at these on a biological level, psychological level, environmental level, I'd love for you each to take a moment, you can read them and see, gosh, how many of these do I identify with? Oftentimes I see a lot of moms in my practice who have had a history of, some period where they might have had a depressive episode, maybe in college, or maybe they just generally run anxious all the time. I see a lot of perfectionistic women who wanted to essentially control and plan out every part of their pregnancy and their birth. And when things didn't go to the way they hoped they did, that can really start to affect mom's identity and sense of self and who she is as she sort of adjusts to this new chapter in life. So this is just again, a quick screenshot of just some of the risk factors that we see with moms that are struggling with PMADs. So that is a really quick overview of perinatal mental health. I just wanted to highlight a couple of things, and hopefully you all, whether you know much about mental health or not, the perinatal period is just unique in that it has a lot of vulnerabilities about it, but there's a lot of stigma. I mean, there's already stigma with mental health, but when it comes to perinatal mental health, I think a lot of that idea that mom should be happy and glowing and this is the best time of her life, that does not always translate. So really briefly, what I love to just share with you, this is my last slide, is let you know what Postpartum Health Alliance does. We are a local nonprofit that works with San Diego families and providers and helping to understand and recognize and respond effectively to mental health during pregnancy and the postpartum periods. So we do this in 3 ways. One, we support the community by, we have a warm line. So a family can call us and say, hey, I 2 months postpartum, I am really struggling. I don't want to tell my partner that I'm having a hard time. I've never even said any of this out loud, but I'm not sleeping. Sometimes I worry about the baby getting hurt. I don't think I'm a good enough mom. I mean, it just, the list goes on sometimes of some of the things that are happening with these parents. And when they call our warm line, we have peer support specialists. These are trained volunteers that call back these families every day, and they provide basic peer support to let them know you're doing an okay job. We will help you. We will find the resources that you need. We're so glad you called. This is common and this is treatable and you're not alone. And just that validation for a lot of these parents it's tremendous for them. And then what we do is we will sort through our referrals and our resources on our website and we email them to the families. Another pillar of what we do is we provide education and awareness. And a lot of this is on our website and our brochures. We have a PMADS 101 training that's geared towards professionals and providers out in the field. So this is OBGYNs, midwives, psychiatrists, therapists, lactation consultants, chiropractors, to help them kind of see how perinatal mental health looks a little bit different outside of your usual mental health. And then finally, we have a membership within our organization where these providers join us. They get access to our trainings, our education workshops, and then they get to be listed as a resource or referral on our website, on our directory. So families can find them, or like I mentioned, our peer support specialists can find them. So that's a lot I just threw at you. Happy to answer any questions or any other thoughts you might all have. Now I'm just like briefly looking at this chat.
Thank you so much, Jen. That was amazing. Thank you for bringing light to the issue and just, as you said, validating people's feelings so that they can move forward and they know about the resources that are available to them. I'm not seeing questions in the Q&A. Sorry, junior leaguers, I didn't go over the housekeeping in terms of Q&A for questions and chat for chat. But we've had several webinars, so hopefully folks know the rules of Zoom nowadays. But this is amazing. Thank you so much, Jen. That's amazing work that you're doing. We appreciate your time today.
Thank you so much. Well, I appreciate being able to share a little about PHA. And if you all need anything else, don't hesitate to reach out to us.
Absolutely. Enjoy the rest of your evening. You're welcome to stay on if you want, or you can hop off too, up to you.
All right, sounds good. Thank you.
Mm-hmm. All right, next up, we have Angeles Nelson from the president of San Diego County Breastfeeding Coalition. Angeles is currently serving as the president of the San Diego Breastfeeding Coalition. She has been part of the board since 2017. Angeles is also a policy advocate with Nourish California, where she specializes in advancing state policy that improves students' access to healthy school meals and increases food access for immigrant Californians. Angeles leads our federal advocacy efforts to preserve, protect, and improve access to the WIC program, maternal health and breastfeeding support. Prior to joining Nourish California, Angeles worked as a community advocate and organizer in Lemon Grove to create a more vibrant community with opportunities, equity, and wellness for all through resident-led community projects. She has mobilized and co-powered many members of her community to successfully advocate for policies that promote wellness, equity, and safety for all Californians. Angeles is a community advisory commissioner for the Lemon Grove City Council, a member of the Kitchenistas, and a resident leadership academy trainer. She considers herself fortunate to work for amazing causes, which include building the first community garden in Lemon Grove, establishing a breastfeeding support group in Lemon Grove, assisting homeless and adults living with mental illness and finding quality housing, and supporting new mothers during labor and throughout their breastfeeding journey. Angeles is passionate about breastfeeding and supporting all families to reach their breastfeeding goals. She loved breastfeeding her 4 children and struggled with tongue tie issues with her 2 youngest. Angeles, thanks so much for being with us today.
Thank you so much for having me. Should I start sharing?
Yes, please, go ahead.
I can't see anybody, but can you see the presentation now?
No.
Hmm.
Are you just hitting share screen?
Yeah, I was trying to share the screen. Is it showing or no?
Not yet.
Oh, I don't know where to click it to share it.
There
Let's
should
see, I
just be a
don't-
share screen at the bottom,
oh, I see.
in green.
Got it.
Perfect.
Yeah. Okay, thanks.
Thank you.
Hi, everyone. Thank you for inviting me. I'm representing the San Diego County Breastfeeding Coalition, and my name is Angela Nelson. I'm serving as the president for this year and next year. And with me is Christina Lares. She is our outreach coordinator. Christina, you want to say hi?
Hi, everybody. Happy to be here.
And we are also a nonprofit organization, and we've been serving the community since 1994. And we have been working on breastfeeding, and our main goal has been the education and support of the community, and also the doctors, nurses, doulas, etc. And our mission is to improve the health and well-being of our community. And we do that by supporting, promoting, and advocating from breastfeeding. As Jen was saying, there is a lot of issues with breastfeeding in our community. She did a great explanation of the landscape and the challenges that many families have exactly at that time when they're having a baby. And all of those challenges affect breastfeeding rates. And the coalition would like to help with some of those challenges. And so our mission is to help on that. And for that, we have a vision where each breastfeeding family will have the support that they need to breastfeed for at least the first year of life, and preferably longer than that, and where every individual will have access to the information and the resources that they need to support their breastfeeding goals. One of the main visions that we would like to see a reality in San Diego is that all healthcare professionals have the knowledge and they can promote and support breastfeeding for all of the families who are having babies in San Diego. And also we see that there is a great difference in the outcomes of breastfeeding in San Diego and in entire California. Some of those disparities include people of color have different outcomes, different rates. And Jen was talking about, for instance, the death rate, and is the same with breastfeeding rates. It's very difficult for some families to get the support that they need. And some of the best practices that we would like to see in the hospitals is to keep the mom and the baby together so they can establish breastfeeding, to have some of the procedures and the exams that they routinely provide for newborns, to have them done in the room with the mothers. And that's one of the areas where San Diego is not doing so great with. We have about 50% of the families being separated for those routine procedures. And then another thing that we would like to see is not providing formula routinely to newborns. And that's another area where we can greatly improve. California has some of the best rates of infant breastfeeding at the discharge from the hospital, but it is really hard to get it established and then continue for a longer period of time. So for those vision that we have for those goals, we have created a few goals, and we work every day to do breastfeeding education, breastfeeding advocacy and outreach. We also have a warm line where you can get breastfeeding advice and some help and resources. And of course, we want to have sustainability. So I'm gonna go a little bit into each one of those. To help the community, we have lactation scholarships, and we partner with UCSD to provide about 2 quarterly lactation scholarships. So we are looking for passionate individuals that would like to get involved in providing support for families, and that they maybe live in underserved communities, or that they want to help or include in their work this part of the support for families. We would like to increase the numbers of experts in the community, and we want to have an inclusive help for everybody in the community. And we also provide workplace awards, and that is to promote best practices in the workplace. And also we provide that for childcare award, and that's for childcare. And this is, we just started this in 2018. And what we do is that we help childcare providers with education, and we help them with their written lactation accommodation policy. And when they provide a special place and adequate facility for pumping, and helping the mom through that difficult change that is from staying at home and breastfeeding your baby to perhaps going to work and having a lot of challenges. We help them with education so that they can provide that support the moms need to be successful through that transition. And then I'm gonna let Christina take on a couple other activities that we do. And I would like to say that all of our activities are by volunteers. We recently got a staff member, actually a couple of them, but we would like to invite you to become a volunteer for the coalition. We have a working board with really incredible members who are very active and very engaged in helping the community. And I'm gonna let Christina take over from here.
Thank you, Angeles. And thank you everybody for having us here today. I'm just gonna go quickly and share a little bit about our educational webinars, which again serves to our vision of ensuring that all healthcare professionals in San Diego County are knowledgeable and confident in providing this education and support to families. And so we do offer educational webinars now on a monthly basis. And we're also working on having a kind of digital library of past presentations, because we have had some great experts in the field of lactation, human milk, and even community-based resources. We just had one this past weekend around maternal mental health. And so we're very excited. And we also offer continuing education credits for nurses, doulas, lactation consultants, and other professionals, so they can continue their education and then at the same time support our coalition by attending these webinars. And we actually have one coming up again on November 20th, where we'll be talking about nonprofit milk banks. So if this is something that you're interested in, we're always looking for new speakers, new connections with community, and spreading the word on some of our activities. We can go to the next slide. Oh, go back one. There we go. Thank you. And then this is a big project that me just drumming on to the team. We have every year, it's a San Diego County Breastfeeding Resource Guide. This is a major project that we have, and we are so proud of this guide. It's actually growing. We have a digital version now that's on our website. So what's great about this resource guide is, as folks, different health professionals that are in the San Diego area, maybe birth centers, midwives, lactation educators, physicians, they become members of our coalition, and we in turn are able to create this guide highlighting all the resources that are in the county. And in 2019, we actually distributed 5,000 copies of the resource guide all over San Diego County, and that's to hospitals, health clinics, and community spaces. So this is something also, if you're interested, we're always looking for volunteers to help us in distributing the guide to hospitals and making sure that every new family, as they leave the hospital, they have one of these guides in their, going home packet. And also, if anybody knows of any design skills or printing resources, we're always looking for help with that as we try to expand this amazing resource. Next slide. And then finally, like Angeles was mentioning, the states and federal advocacy. This is something that we're growing. This has been ongoing amongst the coalition, but in recent years, and with Angeles's amazing leadership, we're starting to take this on and take on more bills. This past year, we were successful in supporting the PUMP Act, which just actually passed the House this past week. And this is to provide urgent maternal protections to nursing moms. There's actually a lot of gaps in allowing, time breaks and lactation accommodations for federal workers, teachers, agricultural workers. And so we're really excited to support efforts like this. Some other bills that we've also supported recently are related to expanding WIC benefits, uplifting paid family leave, and a major bill that's been kind of buzzing around called the Momnibus, which helps to eliminate health disparities, specifically around Black maternal health. As Jen was mentioning, families of color and marginalized communities have some of the highest rates of mental health needs for support, maternal mortality, and infant mortality. And that's something that we just think is unacceptable. And so we were happy to see, actually in California, the governor actually signed the California version of this bill, which expands Medi-Cal for postpartum moms to be up to the first year, increases research so that we can start tracking this data and finding out what's going on and making changes, and also including doula support into Medi-Cal packages. So amazing opportunity if people are interested in getting involved in policy. We are, again, building this program out. So we send out action alerts that are easy for folks to just, pick up the phone, call their legislator, or even just posting on social media. So we're very excited about these efforts going into the new year. And I'll pass it back to Angeles to close us out.
Thank you so much, Christina. I just want to invite everybody, if you would like to get involved with what the coalition is doing, you can volunteer, you can help us raise your voice to pass all of those bills that are really, really needed in the community and to support our breastfeeding families. I can put I'll put a link on the chat so that you can get in contact with us, and please provide your information, sign up to be a member, and help the coalition help all those babies and moms that really need support. Thank you so much. If you have questions, we're here to answer any questions.
Thank you so much, Angeles and Christina. That was really informative information, and it's great how your coalition is just getting all your action together to be able to make improvements. So thank you so much for the information, and especially for also telling us how the Junior League can help you guys out. So I really appreciate it. And let me see. We do have a question in the chat. Do you and the SDCBC have a sister organization for those who aren't able to breastfeed that can provide support for those new parents? You need me to say that again?
A warm line where we can take questions and provide support. And also we are in coordination with the WIC, and the WIC provides pumps for families who can directly nurse. Like I couldn't nurse my baby because he had a tongue tie. So I had to pump for a long time, like 4 months, and then he was able to start breastfeeding. But it took a lot of effort. It took a lot of support from organizations and experienced health workers specializing in breastfeeding. So there is support out there, and we can put maybe Christina, we can put the phone number also for the warm line. And yes. And yes, please contact us if you need any support.
Thank you so much. Okay, next up, we have the Power Mom Consortium Research Group, and this is a group at Scripps Health.
Hi there.
Hey, how are you? I'm about to introduce you in just one second.
No worries.
Perfect. So Dr. Tualashe Ajayi is here with us today. She is a fellowship trained palliative care physician and pediatrician. She is currently the Director of Clinical Research and Diversity Initiatives at Scripps Research Translational and is the primary investigator of this research project she's about to talk to you about, which is an app-based research platform called Power Mom, and she'll introduce it to you today. She's also brought with her Lauren Arnelli. Lauren joined Scripps as a research associate after earning her BS degree in biology from UCLA. During college, she was a lab intern at Scripps in both pink and elderly studies. While an undergraduate, Lauren has spent several summers as an intern at Glissons Inc., at which she gained valuable insight about research and development in biotechnology. In her current role, Lauren supports Scripps circulating endothelial cells and human tumor sequencing studies through sample management and preparation for screening. So thank you both so much for being with us today.
Thank you so much. It's an absolute pleasure to be here. And I will share my screen in a second. And by the way, you did a great job with my name. I'll go by Lashay. Lashay is great. My full name is Toluwa Lashay, and I go by Lashay Ajayi. So if I can have permission to share my screen, I can take you through an introduction of Power Mom, a little bit about me as well, and why we're doing this project. Let's see, it still says disabled screen sharing. There we go. Let me move just this to slideshow and get started. So a lot of the information I'm going to present, you actually went through the stats really, really well. So again, Power Mom is one of the research platform at Scripps Research. And our goal with Power Mom is really to address a lot of the health disparities that you've stated at the beginning of your presentation. I've been here since the beginning, and you guys truly have an understanding about the healthcare crisis that we face in the United States. And the truth is, we can't make any headway in changing policy. We can't make any headway in changing the way that we practice care if we don't have information, if we don't have the tools to say, hey, breastfeeding is important. And even when things happen, for example, during at the start of the COVID pandemic, I work at newborn nursery and I take care of those babies. And initially they were separating the moms from the babies, which didn't make any sense because they're afraid of COVID transmission. But again, 24 to 48 hours later, we were discharging the moms and the babies together to go home, but we're really missing this critical gap where they could be bonding and breastfeeding. And so having information, having quick access to information like that can really change the way that we treat people, treat our moms, and have better outcomes. So I say this as a mom of two adorable, rambunctious children. This is Tiwa. She's my 4-year-old. She was born when we first started the Power Mom project. And this is Kari, who, when we launched the second phase of the project, was just born and is now a very happy, giggly 7-month-old that I can't believe is already 7 months old. As I said, you guys went through the stats of healthcare disparities that exist within the maternal fetal health. As rich as we are as a nation, our maternal health stats are just embarrassing. We are ranked #1 in maternal mortality, and women of color bear the brunt of that, right? So Black and Hispanic women are more likely to have mortality from childbirth. Black women, as you said earlier, are 3 times likely to die during childbirth. Hispanic women in general have a 200% increase in maternal morbidity. So things like gestational diabetes, hypertension, increases to C-section, things that lead to poor outcomes for mom and babies. And that's increased dramatically to 200% over the past 20 years. I'm not going to reiterate the stats because you guys know them really well. The point is that if we don't have information, we can't change how care is practiced. We can't change policy. I was very lucky to work with Dr. Killa Weber, who was one of the legislators that helped pass the California version of the Momnibus bill that you guys just heard about. And it's because we have people who, and Dr. Killa Weber is an OBGYN and was just elected to the California House of Representatives. So having clinicians who are researchers, who are physicians in this field can help push these policies. But again, everybody needs numbers. Everybody needs data to know that we can make a change. How do we know that maybe home births or home monitoring can actually improve outcomes in this population if we don't have the data to show that? And that's really what we're trying to do here at Power Mom. We know that there's a lack of research in pregnancy in general because we were seen as a vulnerable population, and because of that, we're excluded in a lot of research in general. And then you add into the health inequities, right? So women of color are especially at risk for not being able to participate in research. And I will say this mortality that we see in the Black and Hispanic communities, it's not just relegated to low SES. It's not, and I will share my story. So I told you I have two beautiful children that I'm very proud of and I love very much. I'm a pediatrician. I work within a healthcare system here in San Diego. And with my firstborn, I experienced structural racism. And had I not changed my OBGYN, I would have very easily 100% become a statistic. You know, I would have been one of those people that died, and my child would not be here today because of the racism I experienced, because of the color of my skin. And it's not just socioeconomic, but we can't make change unless we have information about how structural racism, for example, affects the pregnancy journey. Information about what interventions help with postpartum depression. Interventions or information about really the importance of breastfeeding, who does it, who doesn't do it, and what are some of those missing information that people are, or what are some of those reasons why people don't breastfeed, right? Having information is power, and we can't change it without that. So again, 60% of pregnancy-related death is preventable. And we know that 90% of women of childbearing age own a smartphone. If you can access your own information, if you can share your information and your own time, and also have a community of other pregnant people who are sharing information, you're more likely to engage in research, you're more likely to join. And if we have information about what makes a healthy pregnancy for everybody, then those of us at greatest risk are helped and can have healthier outcomes. So with Power Mom, we can actually reduce health disparities and build a healthy community in general. How do we know this will work? Back in 2017, when my colleague, again, that's when my daughter was born, and my colleague, Jennifer Radin, was the initial principal investigator, we actually did this unfunded. We had our app embedded in the WebMD pregnancy app, and we had over 3,500 participants enroll. We had amazing amount of data points, and we're actually able to fill in knowledge gaps about rural care access, preeclampsia, gestational diabetes, postpartum depression. Now that we have the new app that I'll take you guys through that can actually get more information, that's able to share information back to the people who are giving us information, they can trend what their data looks like throughout their pregnancy. They can actually get some of the results that we get from this over time. And our hope is that with increased funding, we can even scale more nationally. We can actually pay our participants to stay engaged and stay involved throughout their pregnancy in this study. We can have new innovations about continuous home monitoring. We can do different types of health studies that actually take a deeper dive into the health disparities that exist within maternal fetal health. We can look at, can we actually predict when preeclampsia is going to happen, who's more likely to have that? Can we have a better way to really get information, who has postpartum depression, who's at risk? And because we can identify them, can we then have those early interventions, right? The other speakers you guys had earlier this evening talked about the intervention, the resources that happen. The research that we're hoping to collect will allow us to then change how policy is passed, change the guidelines, and change reimbursement. So some of the interventions you guys heard about can actually be reimbursed, and the participants don't have to pay for this. The patients don't have to pay for it. We actually have evidence that it shows, and it's just part of good care. So what are we asking the Junior League? Spread the word about Power Mom. If you guys have donors who want to contribute to Power Mom, so we can actually pay participants and again, make more or do more innovations, do more subsidies, that would be great. But really the power of Power Mom comes in with the participants, right? Having our participants be partners in research, sharing their data, they have control of what they share and how much they share and who they share it with. The app itself engages our participants. They have the options to sync in their electronic health records. We actually were able to get a grant from Fitbit in which we're able to give away 500 Fitbit Fluxes and the digital scales from Fitbit as part of the program itself. We're also able to actually just in general give away 100 Fitbits as part of promoting Power Mom, and so we can get that data. So again, I'm not just the principal investigator for Power Mom, I'm also a participant. I enrolled in Power Mom in 2017 when I had this little girl right here who's now 4 years old. This is my adopted son. This is Palmer, her big brother who loves her very much. So that's our family, and that's a little bit about Power Mom. I want to take a moment now and show you what it looks like from the participants' point of view. Because what it is survey-based. They get information about, or they give us information so we know that they're eligible. Everything is done from their smartphone. So they'll do a quick intake survey. So we find out when their due date is, and they may not know right away. So they can always skip the question and come back to it later. They can fill in a temporary date. And then once they go see their OBGYN, their nurse practitioner, their doula, their midwife, and they get more accurate information, they can come back and fill that information in. They let us know how many babies they're having. We get demographic information from the moms and also demographic information from the father of the baby if they know it. We get general education information, and we get zip code data. Zip code data actually helps us look at where they live and what resources may be available to them. We get their pre-pregnancy weight, and we try to track that during the pregnancy. So when they do that intake survey, they get that personalized screen up top that went really fast about their pregnancy. And then they also have the option to share their information. So if they want to connect the electronic health records, they have a choice. They don't have to do so, but obviously it helps us the more data that it's better. And then on the resources tab below here, we have articles about pregnancy. Let me go back. I went really fast. So we have different information about during pregnancy, postpartum, lactation and breastfeeding, sleep for the mom and for the baby. So we do have resources. We work with some of our partner organizations to actually help fill in this content because we don't have all the answers. They can withdraw from Power Mom at any time when if they don't feel like it. And if they also get to see a featured article whenever they want. One of the resources that we have is what to expect when you're expecting. They get that information. They can also share their wireless devices that they have if they choose. And again, we provide a lot of participants with wearable trackers as well. Our hope is that as we get launch more nationally, get more funding, that we can actually do more things for our moms. As someone who went through pregnancy herself, sorry, I was just trying to end the share here. I know how hard it is to participate in research, and it's just one more thing that's on your body that you may not want, which is why we make it the service are every 2 weeks or maybe once during the gestations, and we try to give them something in return. So each time they engage with our app, we give them some information. Our hope is that we can create a digital twin, right? So we get the demographic information. You may want to know what's normal for you, what's going on with your body, and somebody who looks like you, who may be in the same age as you. I think the first speaker talked about geriatric pregnancy. I was definitely geriatric pregnancy for both my kiddos. And I was also very high risk, and it can be scary and isolating, which is why we make Power Mom be more of a community and not just a research application. And I'll stop right there and check with Lauren to see if I missed anything or if there's anything that you wanted to add to that.
That was great, Lachey. I'm just going to drop in the chat the website where you can learn more about Power Mom. And again, if you are pregnant yourself or know any friends or family that are pregnant, we welcome you to share this information with them as well, because we welcome all pregnant people to join and participate as much or as little as they want. So thank you so much for giving us the time to talk about the study today, and let us know if you have any questions.
And I will say again, it's not just during pregnancy, it's also the first 8 weeks of postpartum, because we think that information is important. Breastfeeding is very key. I'm very lucky that I was able to breastfeed my 2 children until they were 13 months of age. But we know that a lot of pregnant people have problems with that. Working with we have different groups that actually want to partner with us to look at how we can actually study breastfeeding and make it easier for different participants. So there's a lot that we can do with this platform, but getting the word out and working with community organizations such as yourself to get more people to know about Power Mom, because again, that's where the power lies.
Yeah, that's amazing. Thank you, Lauren and Lachey, for explaining your research to us and how you're utilizing technology to be able to gather data and to be able to make hopefully big scale changes to be able to change our statistics here in the United States. So I appreciate you sharing that information, and that's a really great advocacy opportunity for the Junior League. So thank you all both so much for being here today.
Absolutely. Thank you for the invitation.
Alrighty, so now we are going to introduce different Junior League committees so they can explain what they are doing related to maternal health and wellness. So Jess, thanks so much for being here today.
Hi guys, thank you for having me. I am Jess. I am the Impact Chair this year, and then I actually also am a new mom. I was a pandemic mom. My son is 8 months old, so a lot of this is resonating with me. Thank you in the chat. So a lot of this I have, it's not necessarily new to me, but it is very interesting. So I think it's really great that we're taking the time to shed light on this particular focus area. As the Impact Chair, I want to just let you all know a little bit about our committee. We are a very important part of the Junior League, as we basically we're the way that you can serve your community through volunteerism. So we work with a variety of partners within the community, some of which you've heard from today or you will be hearing from. And we also will be working with a lot of new partners if we decide to move forward with this focus area. So part of what we do as a committee is to bring those volunteer opportunities to the league and present those opportunities to our members so that they can really get involved and make an impact within the community. So due to COVID, we have sort of switched gears in a few ways. We've offered volunteer shifts that are virtual. So if you don't quite feel comfortable to be in person yet, you can still participate virtually. And then we also have a lot of in-person shifts that are on our calendar. If you haven't checked out our Impact calendar, it is packed full with a lot of upcoming shifts. So please check those out. And if you have any interest in Impact Committee for next year, it is a really great place to get involved. I think the Impact members love to be involved not only within the community, but also within the league, because you basically get to meet new people all the time. You get to take part in a lot of different service projects, mostly impact shifts that are done in a day. But it's just a really great way to make your impact on the community and learn a lot about these organizations that you may have not volunteered with prior. So I think that's what's really exciting about the Impact Committee. You can go to the next slide. This is the members who are on our committee. I am the chair. This year we don't have a co-chair, but we do have some really great members, and I'm sure you guys will all get to know them as you continue to volunteer throughout this year. You can go to the next one. So like I mentioned, we do have impact shifts coming up all the time. So we have both in-person as well as virtual opportunities. Some of our virtual opportunities that we have would be the diaper bank that you'll be hearing more about. But that is something that we are always working on to accept donations. And another opportunity that we have for in-person, we just had our Miracle Babies gala shift. And this is a newer organization. I don't believe that Junior League has worked with Miracle Babies before, but they are an excellent organization. They provide transportation and supportive services to parents with hospitalized infants. So those parents who have babies that are in the NICU for various reasons, those are the parents that are getting support from Miracle Babies. And I also learned that Miracle Babies also, they provide free diapers to San Diego County parents that are in need. So they just do a lot of they just have a lot of good surrounding their organization. And then they also just had their 12th annual gala. And so we had a few volunteers that were able to participate with this impact shift. And they've also let us know that they will have some opportunities in the future where we'll be able to help out with their organization. So definitely check Miracle Babies out if you haven't yet. I was able to speak to one of the volunteers and she gave me some excellent feedback from the gala. She let me know that they really are doing a lot of great work overall. She mentioned that they do provide the transportation for families to see their NICU babies, and then they also provide support groups for parents who might be going through the same thing. So like I mentioned, being a new mom, it is kind of isolating at times. So it's always nice to know if there are support groups in your area and other moms that you can talk to and connect with, just so you don't feel so alone. So definitely check Miracle Babies out. If you weren't able to volunteer at this shift, we will have other volunteer shifts coming up in the future, hopefully with this organization as well as some other organizations within this focus area. And that's it for Impact. So please check out the Impact calendar. We are on Digital Cheetah. We also post all of our shifts in the newsletter and within our internal Facebook page. So if you're looking to get involved, looking to volunteer, the Impact is a great way to do it. So thank you guys so much.
Thank you, Jess. You guys are the heart of our organizations. Really appreciate all your work.
Thank you.
Carrie, you are up next.
Try that again. Hi, everybody. It's good to meet you tonight. I'm Carrie Trumbull. I'm the Vice President of the Training Council for JLSD this year. I'm also working closely with Alana and Chelsea this year. And mainly, I just wanted to talk with you about a lot of the events that we have on the Training Council this year that are focused specifically on maternal health and wellness. So last week, we did kick off a 6-part series that started with primarily on fertility and egg freezing and fertility preservation. And the series is going to move on to later this week. We're going to have a session about fertility challenges, in vitro fertilization, and miscarriages. Then the series will move next week to adoption and fostering. So anyone who is maybe interested in gaining information about becoming a parent through either becoming an adoptive parent or a foster parent, we will have that session. We will then move on to the week after to solo parenting and what that can look like for people who are looking to intentionally become a single parent. And then moving on into the latter part of the series, it will be about career and new parent balance and how can parents parent in a healthy way, maintain their careers, and preventing burnout. And then the last session in the series will be about positive and mindful parenting, effective discipline, being able to raise happy, healthy children while being able to stay a happy, healthy parent. All of these events are up on Digital Cheetah for you to be able to register. And we are also welcoming members of the public. So if you know of anyone who is not a JLSD member but could benefit from this information, we welcome them to all of these sessions as well. So we hope to see you either this week or throughout the next few weeks and joining us for one or more of these sessions. And also, just to put it out there, anyone who attends 3 or more of these sessions will be able to meet a training credit obligation. So that's it for trainings updates tonight, but thank you for welcoming us just to be able to talk about these events coming up.
This is wonderful. Thank you so much, Carrie. We appreciate your time and for sharing what's going on with training.
Thank you.
Next up, we have Alexandra Meadows with advocacy.
Hi, guys. I hope y'all are enjoying this training. I know I am. I'm learning a lot. I myself am a mother who breastfed, so I feel like even though I had that experience, I got so many resources from tonight's training. Thank you, Beth. I am very excited about Thanksgiving, my favorite holiday, for those of you that saw that's comment in the chat. Okay, I am advocacy chair this year. I'm Alexandra Meadows, advocacy chair. What is advocacy? So this is sort of like the general gist of how one would be able to advocate politically, legislatively, and through organizations such as the San Diego Junior League. So what advocacy in the simplest form is defending or promoting a cause. We often are doing this throughout the year, like within, it's kind of like weaved within a variety of different ways in Junior League. So you can do this by like attending things like this, volunteering with SPAC, tracking bills, even a lot of our impact shifts are technically advocating for issues and helping to hopefully create change. So politically, we don't do this since we're bipartisan. We don't really campaign for a certain party, but that is one way that you could potentially advocate. Legislatively, we like kind of are adjacent to this with SPAC bill tracking. The last one, organizationally, this is how we involve ourselves with advocating in issues of public policy, such as educational meetings, distributing educational materials, and then, you know, just in our everyday life, being more informed and word of mouth, trying to advocate for the issues of our community and trying to address those through volunteerism and contacting people in power. Okay, next slide, Beth. So as I mentioned, what do? We educate, primarily provide provide information on issues affecting our community, such as statistics and data. We learned a lot about that tonight from these different nonprofits. And then educating league members on nonprofits and community partners that help with these issues and bring awareness to these problems to our community. And then with training, we're equipping league members and community members on how to advocate for the causes needing to be addressed in our community. So through, like I mentioned, bill tracking with SPAC, writing letters to representatives and members of the Senate, members of Congress, reaching out to nonprofits and our community partners and identifying needs while also publicly informing the community of said needs. So that's a big one. And then through events. So we are going to be hosting a couple of events this year, which I will get to on the next slide. Okay, advocacy in action, get involved. Join us for our training next week, next Thursday, called How to Be an Advocate. It's at 6:30. It's in Digital Cheetah, or signups are in Digital Cheetah. It's going to be a webinar similar to what you're seeing tonight. Unfortunately, it is not an in-person event, but we will be basically going into more depth about what I just mentioned, like how you as a JLSD member can be an advocate and what that is going to be looking like in shifting our new focus areas. If you are a provisional member, this is a really good event to go to if you want to learn more about what the advocacy committee does, / a lot of people that have been in the league for a long time don't know what the advocacy committee does. So this is a really good event to come to. And it's being put on by us. So it's a league event only. And then in January / February, we will be doing an educational series featuring maternal health experts similar to kind of what we did with anti-human trafficking last year. I don't know if there are folks here tonight who attended that series last year, but it's going to sort of be like that. But we're going to be incorporating maternal health experts and as well as those who work in food insecurity, addressing food insecurity in San Diego. So look for that later this year. It's in the works. And that's it for now. We will potentially be popping in your lives with like maybe some other advocacy ideas and events that will come our way. But in terms of formal action items and formal events happening from the advocacy committee, that's what we've got for now. We're going to be involved with Little Black Dress in March, but that's what we've got going on. So thanks, Beth, for having us. We have a really wonderful committee this year. We've started pretty much from scratch with all of this stuff since we're shifting our focus areas, and I'm very proud of my committee for just going boots on the ground and doing all their research and really figuring it out. So yeah, thanks guys.
Thank you so much, Alexandra. I know I'm personally excited about this maternal health and wellness experts because I really enjoyed the human trafficking program that y'all did last year. So thanks so much for organizing that. And thanks for talking to us about your work today. Next up, we have Stephanie Burris with SPAC. Thank you, Stephanie, for being here.
Thank you so much for having me. I'm very excited to be here on behalf of the State Public Affairs Committee. So State Public Affairs, what is that? We are the actual political arm of the Junior League of San Diego. We work here in San Diego amongst us, but we also report to what's called the California SPAC or Cal SPAC. You may hear that. And that is comprised of 17 other leagues across the state and representative of their teams up there. We have a political partner in Sacramento called Political Solutions, who helps us out and is our representative in Sacramento. I just wanted to give a shout out. So I am the senior SPAC delegate. Molly Dishman is my junior SPAC delegate, who will be taking over next year. And our two legislative liaisons who we cannot build track without are Cassie Carlisle and Ashley Keller. You can go to the next slide, please. So yeah, a little bit about SPAC. Essentially what we do is we take our focus areas, our missions, our community outreach, and our impact shifts, create a matrix for that. And these women at Political Solutions look across that and determine the best bills for us to support so that we work across a large coverage area of what types of bills. What happens is they assign bills to us that are going through the California legislature. So your state Senate and your assembly. And any of those are ones that we will analyze, look at pros and cons, and decide whether we want to support them or not. And then we will, on behalf of Junior League, support those bills and send letters throughout their entire bill life cycle from the moment that they make it onto the floor of their house all the way to if they go to the governor, we will send letters to the governor as well. Let's see, let's go to our next slide. I did want to go over a few pieces of legislation. So because this isn't a focus area for anyone here, these are some bills from 2018 that were supported by CalSPAC that did become law. So just to quickly go over them, AB 1976 required that if you are nursing at work or if you are a breastfeeding mother who has to pump at work, you cannot be a bathroom. So now you're not sitting next to someone doing their business. And that is something that the CalSPAC made sure that we supported. AB 2193 allowed healthcare to provide maternal mental health to anyone who is seeking it so that your healthcare plan will call and check in on you after giving birth. AB 2698 defines early childhood mental health consultation services. It's essentially putting pressure on these preschool programs, general care programs to provide more support to children. I did also want to say there are a few bills that unfortunately, we didn't support this year, but are in our wheelhouse if we move forward with this. There was HR 11, which is just a House resolution. It's not an actual bill that already passed quite quickly, and that is Maternal Health Awareness Day. So at least that is bringing to the forefront of the legislature that this is something that we need. There is also AB 1407, which is an implicit bias course, which I think is really interesting. And that anyone who works in a perinatal facility or in a perinatal role has to go through an implicit bias course so that they understand that all of their patients are receiving the care that they need, not that the care that the nurse thinks that they need. So given what we saw with those numbers about Black maternal health and wellness, not being on par with anyone else, that implicit bias course is very interesting. Things to look forward to. We have been approached and might possibly be able to co-sponsor a Momnibus 2.0 bill that's coming forward to the legislature next year. So keep your eyes and ears peeled on that, because that would be a huge coup for us to be able to actually have our name on a piece of legislation. And I believe that's it. Keep your eyes peeled. We're working on a lot of educational stuff so you can be a better advocate and a better San Diego junior leaguer and more informed.
Thanks, Stephanie. This really highlights how we can make a difference on the macro picture of maternal health and wellness. So I really appreciate you speaking with us today.
Thank you so much for having us.
Next up is Carmen with the Community Action Committee.
Hi there, can you hear me?
Yes, we can.
Okay, great. And I'm sorry, I'm not able to turn on my video right now, but hi everybody, I'm Carmen Jones from the Community Action Committee. This is a new committee this year to Junior League, and
Carmen, you're on mute, and we have the ability to just change slides here. So you can just say slide and then we'll change it for you.
Okay, all right, I think I'm here in action now. Okay, so our goals for our committee is to collect 22,000 diapers in 1 month supply of feminine products for 2,022 women, local women here in San Diego. We're going to host 3 distribution events to 5 different community partners. Next slide. So this really ties into maternal health and wellness. I think it's pretty obvious how it does, because, you know, women and moms who are struggling financially in the community have to face these tough decisions, like, should I buy diapers or do I buy food? Do I take care of myself or do I take care of this expense? So it all kind of ties into financial insecurity, food insecurity. And so it is a really important initiative that we're providing these diapers and feminine products to women and moms in need. And these are the community partners that we distribute their products to on a regular basis. And they almost all help moms and children in the community. So it's a real vulnerable group in our community. And I'm glad that we're advocating for them and giving them that visibility. Next slide. All right, so we're on a good roll here as far as our collecting goes. These are kind of our stats from our first in-person donation drive, and we're continuing to collect in a variety of means, products from across the community. Next slide. And here is how we're tracking towards our goals. So we're 4% towards our goal of our diapers and 15% towards our goal of pads and tampons. Next slide. And if anyone hasn't heard this yet, if you're interested to help us out, you can sign up for a virtual diaper drive in Digital Cheetah, and you just purchase a product through the Amazon link and you'll get your impact credit from that. You can also drop off donations at the house. And then something new that we're trying is we're reaching out to gyms, daycares. I reached out to my daughter's elementary school to see if they could host a diaper donation bin. Elementary schools, especially, because of a lot of moms with kids in elementary school might also have a baby at home. and have some diapers that they can drop off for us. So if you have any ideas or suggestions, please shoot me an email. We'd love to get your thoughts and feedback on this. And I think that's it.
Awesome. Thank you so much, Carmen. I'm
Thanks.
always impressed with y'all's statistics. So I really appreciate you being here with us today.
Thank you so much.
And we are 1 minute over time. However, so for folks that need to go ahead and head out, please feel free. But for folks who want to stay on for a few minutes, the next part of this presentation is to discuss the Maternal Health and Wellness Challenge Week that we did a couple weeks back. And Alice Maples is here with us, one of our league members, and she was a participant in the challenge week. And so we just have a few discussion questions that she will lead us through. And again, if y'all have time, stick around. If you don't too, feel free to sign off. So Alice.
All right, thank you so much for organizing this. You've done a great job so far, Beth. So thank you so much. And for all the panelists, it's been amazing. So let's start off by just having everybody in the chat, just so you get your little fingers ready to type. Where are you currently at in San Diego? So make sure it's to everyone. So I am currently I want you guys, you know how like sometimes you get kind of like typing shy? So just so we kind of break the seal. So just type where you are at. Okay, we got Mira Mesa, we got Carmel Valley. All right, we got La Jolla. All right, woo! We are all over. I'm new to San Diego, so I'm still at school. I'm learning some new things. We got all over San Diego County. All right, so thank you for typing in the chat. Now, so it's a little more interactive, so it's not just me talking, it's also you typing. So we did a challenge here. So some of the challenges that were kind of presented via Facebook were that they did what it was like to have to budget with diapers and childcare. What were the maternal health policies at your work? What were the diaper changing stations like at your work, or just kind of around, and then self-care, et cetera, et cetera. So for those of you that participated, or maybe you did not participate, out of these challenges, what do you think would be the most difficult for you to kind of do or adhere to? Or maybe you are a mom. What is something that has been extremely challenging, as a new mom? So now that you got your little typing fingers already, let's have you share in the chat if you're open to it. Otherwise, I'm gonna start making up stuff. I'm just kidding. I don't know if you can even see my face, but that's all right. So, I'll just start talking. I was just thinking, so I am an entrepreneur, and so I work from home, and I was just like, man, personally, I was like, that seems like a lot of work. I was like, I'm just taking care of this dog right here, and I was like, that is sufficient. So, and Beth said in the chat that she thinks that it seems like things are out of her control in terms of maternity policies, and that would definitely for sure be stressful. Thanks for contributing here, Megan. But oh yes, securing childcare would be super challenging. It's like you have to see if this person is a good person for your children, and then if your care calls in sick, oh my goodness, what would happen? It's rough, right? All right, so Christiane, your mother raised 6 daughters. Kudos to your mother. I feel like these are like, she's a superhero, right? And let's see. Okay, so Kristen, sleep deprivation is not fun. Wow, yeah. Okay, I am spoiled with my midday naps. Let's see. So I'm just reading some of the things here. Okay. So Krista, you're saying something. Is that something? Okay. So are you sharing somebody that you recommend? Let's see. Breastfeeding or formula. being a healthcare professional that pushes breastfeeding speech therapy. Okay. Not sure what that's about. All right, thank you all for contributing here. So just, I think these challenges are meant to just kind of, well, some of our league members are actually experiencing what it is like to be a mother and working, or a mother at home, and just all things that kind of go with that. And then for those of us that are not mothers, it's just, having another whole elevated level of empathy and care, and just kind of awareness of what moms are, going through. So just kind of really just bringing our awareness and opening our minds and our hearts to just, this focus area, and just kind of the challenges. All right. Thanks.
Thank
Beth.
you so much, Alice. Yeah, that reminds me at my, I hope that you guys found the conversations fruitful at your neighborhood GMMs last month. I'm looking forward to reading all the notes from the note takers, but one thing that I really liked that was brought up was that when we think about all these challenges, have the poverty lens on. So not necessarily you, but if you're impoverished and then also going through all of these challenges makes it so much more difficult. So I think having that lens and then really reflecting on that makes it a really powerful experience. So thank you, Alice, for leading us through that. And last slide, please. This is a cute quote to end, but behind all your stories is your mother's story. For hers is where yours begins. So I appreciate all of you guys for being here today, all of our community partners, for those that are still logged on. Appreciate you sharing your information about what your organization does. And we look forward to seeing you at the GMM in November to discuss both food insecurity and maternal health and wellness. I'm talking to the league members here. So we can determine which area that we want to move forward with. And the voting will take place in January. So thank you all so much. And I hope you have a great rest of your evening.